This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Living your best Delmarva life. Many smokers want to stop but can't, and that's probably why each year smoking is one of the top New Year's resolutions. Joining us today from PRMC is Jeannie Roof, Executive Director of the Grary Heart and Vascular Institute, and also Stephen Wilson, you're manager of the cardiovascular surgery at PRMC. Thank you for joining us. Now, you know, we know that smoking is bad. Smokers know that smoking is bad, but sometimes it's good to kind of revisit the statistics.
It is. Actually, the leading causes of death in this country haven't really changed over the past 3 years. And the 4 top leading causes of death are heart disease, cancer, chronic respiratory disease, and stroke. And all of those are directly correlating to smoking. And smoking is the #1 risk factor relating to heart disease as well as to cancers. Women and men who smoke, men have at least a 4-time greater risk of developing heart disease than men who don't smoke. Women have at least a 2-time greater risk of heart disease than women who don't smoke. The same correlation is even greater for people developing lung cancer. So again, strong correlation to the effects of smoking and illness and death.
Yeah, right. And Stephen, you work in surgery, and you actually see the people you see are the people who have already suffered the consequences of smoking to a degree.
Yes, as a physician assistant at the hospital, I work with the cardiac, thoracic, and vascular surgeons there, and we're seeing the patients who were unable to stop smoking essentially, and they've come in with the complications of that process of smoking, particularly in the lung disease issues. We all know about the cancers, but even some people, it's even more debilitating with the chronic lung disease. And then in the heart surgery part of it, where I work, we get a double dose there, where the patients not only have heart disease because of smoking, but they also have the lung disease that goes with the smoking, and it makes it even more difficult for them to get through those operations.
Yeah, and in fact, we have some pictures we want to show here of what a normal, healthy lung looks like. Can you tell us about that?
Yes, this is a picture, one slice of what we call a CT scan, which I think most people are familiar with, and you're looking at the lung, and it's actually the lungs are on both sides. In the middle there are some other structures, but you're seeing what is normally considered a normal picture of lung tissue in a CT scan. And you can see where there's some white areas there. Those are what we call bronchial tubes and so forth, but the tissue outside of that is fairly dense, and it's what would be normal.
And then our second picture, this one is of one with lung disease.
Yes, very bad lung disease here. What you're seeing is what we call blebs, and you can see how the tissue, the normal tissue of the lung, has been destroyed, and you have these big black holes, if you will, on the lungs. And that area does not allow for the exchange of oxygen from the lungs to the bloodstream. So these people are very short of breath. A lot of them are on oxygen, and all the other complications that come with that disease process.
Now, the last thing we want to do is make anybody feel bad if they are a smoker and they're trying to quit. Perhaps they've already quit but then picked it up again.
Absolutely. I think it's so important for people to understand that the effects of smoking are all dose related. So first of all, cutting back and smoking less is going to be so much better than continuing or even increasing the amount of smoking. And we all know that nicotine is a very powerful addictive substance. So oftentimes it takes many trials or many chances or opportunities to stop smoking. So we don't want people to get discouraged that, gosh, I went back to that cigarette again. It's important to understand what triggered you to go back to that cigarette, but just think of it as each day I'm making the choice not to smoke, or I don't really need this cigarette that much. A lot of this isn't new information, but I think we just have to reinforce to people the importance of taking it step by step, taking each day. Don't get discouraged. You can do this.
Right.
And the health consequences are going to be so much better as a result of that healthy choice.
That's right. And you know, you can go online, you can find all kinds of sites that'll show you how to quit. We found something pretty interesting. There is an app to help you quit smoking. It's called Quit Guide, and there's a look at it, the free application. It's developed from the National Cancer Institute. It was actually written by tobacco control professionals and cessation counselors with the help of ex-smokers and experts. Now, this app is designed to help you prepare to quit smoking and support you in the days and weeks after you quit, because it's more than one day. And the app allows you to search for content using keywords, save specific pages. And what I think is interesting about this app is you can hook it to your social networking so that you can get some support from some other people. Thank you so much for joining us today, and very interesting information, and thanks to PRMC. If you'd like more information on what we talked about today, of course, you can find it at our website, delmarvalife.com. Just click on the show tab. Still to come on Delmarva Life, making a haven a home. We'll take you to an animal rescue on the Eastern Shore and introduce you to a woman whose life work is saving animals, both big and small. That and more when Delmarva Life continues. Stay with us.